So Irina Usherenko, thank you so much for agreeing to be with us today to be part of our People of PQMD series. And Irina is the Senior Program Manager from the Max Foundation, one of our wonderful members out on the West Coast. And the Max Foundation, for those of you who may not be familiar, is a nonprofit global health organization that provides cancer patients in low and middle income countries with humanitarian access to life-saving treatment and care that is otherwise not available. It's an amazing organization, and I myself had the chance to visit a couple of years ago and participate in one of your gala evenings, and it was really, really exciting to see the incredible work that you do and the impact that you have on so many people's lives around the world. So thank you very much for all that great work. So, and thank you for being here today. So I'm sort of just going to start with a question a little bit about your background. So I've noticed that you have a background in sociology and neuroscience, community public health, and women's leadership, and worked as a medical rights advocate with commercial sex workers and human trafficking, and then also with the Global TB Alliance, which is just an incredibly diverse and wonderful background. So I'm wondering, how did you come to join the Max Foundation?
Thank you so much for having me. It's really an honor, and I'm glad to have a chance to talk a little about the Max Foundation. So really, I have a public health background in international health and community health. And a lot of my career really has been focused on access to medicines and resources. So when I was working with sex workers in South Africa, a lot of it was focused on ensuring that sex workers have access to health services to prevent the spread of AIDS, and also making sure that they have access to condoms to prevent AIDS infection. And really after that, I went into infectious diseases and sort of switched gears from working in HIV to tuberculosis at the TB Alliance. And primarily my work there was also focused on ensuring access to better medicines for pediatric patients suffering from tuberculosis. And I worked in that area for a long time, trying to improve treatment of making child-friendly medications available to countries around the world. And then I switched gears again to work in non-communicable disease, and that sort of brought me into working in cancer at the Max Foundation. And our work there is also focused on ensuring access to treatment for chronic cancers. And so really my career has focused primarily on access to medicines and health services for really those low and middle income countries that wouldn't otherwise have access to medicines at all.
Well, thanks very much. So you have NCDs and NTDs, and that's really fantastic experience. So tell me a little bit about the Max Foundation's work and some of the areas that you are currently focused on.
Sure. So we at the Max Foundation really support patients with chronic cancers in low and middle income countries that don't have treatment, that don't have access to treatment in their countries. So we focus on both access to treatments, but also a huge part of the work that I lead is access to diagnostics. So our model, and thanks to our model and multiple collaborations, we're able to deliver the right treatment at the right time. And our model is, at the forefront of our model are the patients. So our global team really looks at patients, individuals, and looks at the needs that they have, whether that's navigating their cancer, understanding their treatment, or connecting them to the community through their local patient advocacy group, where they can get additional education through workshops that the Max Foundation supports. And really not only is our mission to ensure access to treatments in these low and middle income countries, but it's vital to also ensure that they have access to diagnostics.
So I'd like to ask, how is the Max Foundation addressing the global need for improving access to diagnostics?
So through multiple initiatives that we are running, but I think I'd like to tell a story about our experience in Tajikistan. So in about 2017, one of our team members visited the clinic in Tajikistan and met with the patients there, and she saw that visibly she could see the enlarged spleens in these patients, which is, that shows for CML, for chronic myeloid leukemia patients, that's when it's untreated, we see these large spleens. So, these patients had no access to diagnostics and therefore could not enroll and benefit from our program. So these patients, in order to get diagnosed, they would have to mail their blood to Russia, which was not really an option for many of these patients. So after returning to Seattle, we started the Spot On CML program, thanks to a collaboration with Fred Hutch and Dr. Jerry Radich's lab. So Dr. Jerry Radich created this novel and low-cost way of taking blood samples, dry blood samples on paper. So we would get these samples from the institution and then mail them to Seattle and hand deliver them to Fred Hutch, where they would run the tests, the blood samples, the dry blood at the lab at Jerry Radich's lab. So, this is really Tajikistan, after visiting, was the first country to benefit from the Spot On CML program. And since then, many other countries have benefited as well, particularly those that have no way of accessing any other diagnostics. And since then, Tajikistan actually has benefited from our other initiative called the Solidarity Fund, where they've actually been donated their first gene expert instrument in 2019, so last year. So through the Solidarity Fund, the Max Foundation is committed to providing all the diagnostic needs for our country. And we're really focusing on 14 key countries, but we wish we could do more. So, even though the Max Foundation has preferential pricing through their collaboration with Cepheid, it's still very expensive. The tests there are reduced to a price of $50 each, but this is still a financial obstacle for many of our institutions. So the Solidarity Fund is vital for ensuring and supporting those institutions that still can't afford that $50 price tag. So that's some of our initiatives that we hope that others can learn more on and support us as well.
Diagnostics and treatment is obviously something that is front and center in everybody's minds these days, particularly given the pandemic. But tell me a little bit more about why access to diagnostics is so vital to treating the cancers that you work with, and really how do you get those diagnostics to the community health workers and the people who actually go about implementing the diagnostics?
So ultimately, we can't treat what we can't diagnose. And unfortunately, these diagnostic tools are very expensive. So, I think it's important to state that monitoring for CML, for chronic myeloid leukemia and other chronic cancers is important for treatment management. And because we are talking about chronic cancers, this is a lifelong need. So for our CML patients, we need to monitor treatment to understand if it's working against the disease. And if it's not working against the disease, then we need to be able to adjust the treatment and put the patient on available second-line treatment where they can better adapt. But it's also really important to understand that many of our partner institutions don't have access to diagnostics. They don't have gene experts to run the diagnostic test on site. And those that do have access to gene expert on site still can't afford purchasing the tests necessary to run the diagnostics for chronic myeloid leukemia patients, which require a different assay and still create a major financial burden for the institution.
So chronic disease is obviously something that can't be stopped. I mean, you can't just decide, oh, I'm sorry, I can't get to the patient, or I can't, provide the drugs, or I can't even find the diagnostics. I mean, it's an ongoing challenge and something that has to be, kept up on all of the time. So an unfortunate pandemic is something that's difficult when it gets in the way, because obviously it's going to sort of takes a shift in the way things are managed. So during this current COVID-19 pandemic, how have things changed for your work? And how is the Max Foundation dealing with the life-saving treatment that you offer? I mean, I recently read it's over 30,000 patients in 70 different countries. And there are many, many limitations that are posed now by having to respond to this virus. So how is Max Foundation handling it, and what are perhaps some of the lessons that you've learned that might be useful for other organizations that are addressing other chronic diseases?
Sure. So we have definitely seen a huge impact of COVID-19 on our delivery of treatments for our patients. So as as a lot of the states in the US have gone on lockdown and, have forced people to stay at home. A lot of our low and middle income countries have also seen the effect of that. And a lot of the countries have gone on lockdown. So in order for our patients to be able to access the treatments that we deliver, they need to go and visit the institution every 3 months to get their treatments for the next 3 months. And since a lot of these countries have gone on lockdown, these patients are not able to travel. Either the transportation has been canceled, or they physically, it's a risk to them to actually go to the hospital and pick up their treatments. And additionally, a lot of these hospitals have really where they previously were focused on treating cancer, have now changed and focused on treating COVID-19. So what the Max Foundation is really working on is trying to get home deliveries. So really, because of COVID-19, many cancer patients are, because of their immune system, are actually more at risk of getting COVID-19. So we also want to reduce the risk of them getting infected by leaving their home and having to pick up their medication at the partner institution. So, what we've also seen as, I think, a lesson for this situation in COVID-19 and many other sort of diseases that might come in the future is, we've seen that people are resilient, and we've seen so many heroes in our countries that have stepped up and helped pick up these medications and deliver them. So we've had stories globally around the world in all the countries that we work in where, police officers are coming and actually picking up the medications and hand delivering them to patients. And physicians themselves, our partner physicians, are hand delivering medication to their patients, knowing that they're so at such high risk. So, we've really seen many heroes along the way that have stepped up to help address this issue.
Thank you. And so for those who want help with cancer patients in lower middle income countries to have better access to treatment and diagnostics, as you said, What can they do and where can they go to learn more and more importantly, get involved and not only financially, but also either volunteering or being one of those angels who are bringing the products and the diagnostics to people who need them most? Where would you go?
So right now with the current situation with COVID-19, it's really hard to make sure that cancer patients' voices are still being heard because really the focus right now is on COVID-19. And, I think it's really important, we would benefit from people to continue to raise their voice for those cancer patients that may be even more affected by COVID-19 and more at risk. Um, of contracting the disease. So I think it's really important for us to get help to keep people remembering about those cancer patients that are being affected by COVID-19, even though the majority of the focus is on the actual disease of COVID-19 and fighting that. And then just, our Solidarity Fund, like I said, is primarily funded by outside donors. So that would be an area that would benefit from support as well. And we also have some incredible patient stories of survival and overcoming challenges of cancer for both during this COVID-19, as well as before then. So I encourage people to seek out those stories and learn more about what patients are faced with through our social media, as well as checking out our blog at themaxfoundation.org. And so that would what I would encourage people to learn more there.
Thank you very, very much. I think people who are immunocompromised are definitely in a unique situation. And I know that you hear about those stories that are literally your neighbors, not necessarily from countries all over the world. And so there is a certain amount of real community that dealing with chronic disease creates. It's a bit perverse, but I think it's really fantastic. Well, thank you so much for your time, Irina, and thank you so much for being part of PQMD. We really value the Max Foundation as a member of our network, and we really, really appreciate all of the amazing work that you do and all of the much needed support, diagnostics, and treatment that you bring to people suffering from cancer around the world. So thank you so much for your time today. And
Thank you
please
so
stay
much for
safe.
having me.